This new song is hysterical to me. And so anyways, I love it. Shout out to Bernadette Quist for writing it and all the amazing musicians who recorded it, right? It's just fun. So we are so excited about this next episode with Good Fat Life. My guest is Dr. Linda Dobis. And she, full disclosure, we met in our knitting class, right?
Hey,
right?
Yes. I'm a novice. You're not.
Well, no, I am. I've never had I've never had a knitting class in my life, and it's so fun to like go, oh, that's why you do this, or that's right.
I'm learning a ton. Not only knitting, but our little collective clatch of ladies. I learned so much from them.
I do too.
Yeah.
And we were having a discussion about Dr. Paula Ruffin was on, and she's made the comment about how do you want to live the last 10 years of your life, right? And so we were talking about that, and then Linda, it pops up. Do you like Dr. Linda?
You call me
whatever.
Linda.
Okay,
Linda,
I mean,
yeah.
I do in class. But I
call
want to
me
be
Linda.
respectful. It's a big deal to
good.
have your doctorate. But she was saying, we started talking about teeth and periodontics. And I don't know anything about it really, except one of my very dear friends has just gone through some horrific surgery on her gums. It's been a real ordeal, but she's been thrilled to death to be able to have it.
Yeah.
So tell us, what is this?
Yeah, buckle up. Let's go.
Yeah.
Gum disease and your teeth are the first step in digestion. And that question that you asked about how would you like to live the last 10 years of your life, really, I enjoy talking, smiling, eating, that kind of stuff. And let's go back to eating and smiling and talking. Well, your teeth are front and center when you smile and when you talk. So for proper phonetics and to invite people into your world by smiling, that's step one. Another thing is proper nutrition. The first step in digestion is to chew up your food. If you can't chew your food properly, you end up swallowing whole pieces of food or mush, and then there's not a lot of enjoyment nor nutrition in that. So proper maintenance of your teeth is part of the function of enjoying the last 10 years of your life.
The last 10, yeah. I mean, I can't imagine. I see a lot of older people drinking those drinks, those high protein drink shakes. And
Right.
And I mean, there's multiple reasons, but still the idea of just having to drink your food just to get nutrition, no, thank you.
No, and 47 to 60% of the world population will suffer from some form of periodontal disease in their life. The older you get, the more likely you might suffer from that.
But what is it? What is it?
That's a great question. So in the past, your parents, my parents' generation, it was part of, you get old, you get gray hair, and you lose your teeth. That doesn't have to happen anymore. We all would want to get old, but it would be really
nice. We say
nice.
older.
Older, okay. Perfect.
Right.
But we kind of want to keep our teeth, and we can keep our teeth. Prevention, an ounce of prevention, that was Ben Franklin who said, an ounce of prevention is worth a pound of cure, and it's so true. So prevention is the key for maintaining good your teeth over your lifetime, actually. So our recommendation is that you brush twice a day, every single day, every morning, every evening, and that you floss every single day too. It's kind of an easy thing to do once you get into a habit. And, it takes about 2 weeks to form an actual habit. So if you can just...
Depends on the habit.
Yeah, that's true. Brushing and flossing, I guess that's, it's a really good, healthy habit to get into.
What is periodontal? I mean, I'm not even sure how to pronounce it.
Periodontal disease. Okay,
what is it?
The first sign of periodontal disease, or the first thing that shows up is gingivitis. And let me dissect that for you.
What is that?
The suffix itis implies inflammation. So if you have an appendicitis, your appendix is inflamed. If you have arthritis, your joints are inflamed. If you have gingivitis, your gums are inflamed. And gingivitis begins with plaque accumulation at or around the gum line. Plaque is that soft, white, gooey stuff that forms on our teeth. You can usually scrape it off with your finger. If I scrape some of that off and put it on a microscope slide and look at it under a microscope, it's made up mostly of bacteria. There's also dead skin cells and other debris in there, but there's mostly bacteria. I know, if you think about it, yeah. And so in a normal, healthy person, we can combat that a little bit, but if the plaque is not removed, a couple things can happen. One thing that can happen is that over time, if you don't remove it, your saliva has mineral content in it, and it can mineralize the plaque, and that's what we commonly call tartar.
Oh, okay. So when you get your teeth cleaned and they're scraping that.
Yeah, that means you haven't removed all the plaque.
Okay. All right.
And then it hardened on your teeth.
Well, now to be fair, my hygienist says that there's certain spots that are really hard to do. And
That's true.
And that's why you go in every 6 months. But is gingivitis, does it show up with, like, if you floss your teeth and they bleed? Is that how it shows up?
Yes, and most people ignore the signs of gingivitis because it doesn't hurt.
Okay.
So one sign you might notice in your mirror is, when you floss, it bleeds. It might only bleed if you provoke it, like with floss. But some people, if it's not addressed, the bleeding becomes more frequent and maybe even unprovoked.
Okay.
So the first sign of gingivitis might be puffy gums or even bleeding gums. And then if it's not addressed, then the bacteria that's around your teeth the composition can actually change and go from being kind of irritating to gum tissues, and that's what it actually is doing. It's irritating your gum tissues, to actually breaking down the tissue and ultimately breaking down the bone. And then when the attachment, the gum tissue and the bone break down, that's what we call periodontitis. So,
okay.
So let's wordsmith that for a minute.
Okay.
Itis, inflammation.
Right.
Odont is from the Greek word for tooth, and peri means perimeter. So around the tooth inflammation. If we start to get breakdown,
okay, there you go.
Breakdown of the gums and the bone. And gingivitis is a reversible process. With 7 to 14 days of adequate brushing and flossing can actually reverse the signs of gingivitis.
Okay.
With periodontitis, when there's actually been loss of attachment, gums and bones, that's not reversible, but the clinical signs can improve. So once you have breakdown of the bone and the gums, then it's a matter of maintaining things so that they plateau and the breakdown process doesn't start all over again. So that's the difference between gingivitis and periodontitis is.
How long can that take?
Great question. So gingivitis can take anywhere between a week to 2 to 3 weeks of not brushing and flossing for the clinical signs to show up. Okay. And then 7 to 14 days of adequate brushing and flossing can reverse that.
Got it.
So brushing twice a day and flossing every day. And regarding how long it takes for the gingivitis to morph into periodontitis can vary between person to person. Some people are more susceptible to that bacteria than other people. And that's a big factor in periodontal disease too, is how susceptible are you to that bacteria? That can range from heredity to extrinsic things like smoking, poor diet, medications, and just overall health can affect how your body responds to that bacteria and how susceptible you are.
So when would somebody, like I said, I don't know anything about what you do.
Yeah.
So when would somebody come to you?
Okay, that's a great question too. Usually your general dentist you'll go there for prevention. Remember Ben Franklin, an ounce of prevention is worth a pound of cure. If the gingivitis they have been managing morph into periodontitis, that can still be treated in a general practice. If it goes beyond a certain pocket level, because we take those measurements around, we take 6 measurements around the tooth at least once a year, sometimes more. And I like to tell patients that it's a PAR 4 course. I like these probing depths to be 4 millimeters or less, and there should be no bleeding or inflammation.
When you do
That's right.
Okay.
So if we are probing consistently 6 or greater around the teeth or there's discomfort and evidence of bone loss on the x-ray, then the dentist can start to think about referring to a specialist. If it's 7 millimeters or greater, that is usually when a patient is referred to a specialist like myself. And then we assess the patient. We take a whole clinical exam, dental exam, including oral cancer screen, and we assess the TMJ, and then we determine, first of all, we have to figure out, well, how is this, what's causing this? Is it an oral hygiene problem only? Is it hereditary? Does the patient have secondary factors like smoking that we can address along the way?
Or medication or
medications.
something?
And then we can determine the best line of treatment for the patients. A lot of times it's non-surgical treatment.
Okay, that's good. I just assumed if they got to you, they were going to have surgery.
No, a lot of times, the patients have great response to non-surgical treatment. It's called, the first step is typically a procedure called scaling and root planing. And that some people call it a deep cleaning.
Okay.
Scaling is simply scraping the junk off your teeth. When you go in for a routine cleaning, every 6 months or so, what they're doing is they're scaling the teeth. Okay, and that's considered to be either a preventative procedure or a maintenance procedure. It's to help prevent gum disease, or it's to help maintain treated gum disease. And then, so we do that. And then root planing is actually the process of going underneath the gum line to remove the deposits. And by doing so, then your body takes over, and then there's a good likelihood that the gum tissues will tighten and shrink, thereby creating a more healthier environment, which is a smaller, shallow pocket or probing depth. Yeah, so we like to micromanage things.
Got it. Well, that's very informative. Like I said, I had no idea. I just assumed by the time somebody got to you, it was like devastating.
Surgery. No. It's a lot of times. And hand in hand with that is we really counsel the patient on proper hygiene and maintenance, because once there has been breakdown of the tissues in the bone, we do need to maintain that because the patient becomes susceptible to that reoccurring.
Okay.
Because they were susceptible in the first place, and if the hygiene hasn't improved or compliance isn't maintained, then the whole process can start over again. So oftentimes the patients who come to us don't get their teeth cleaned every 6 months anymore. It's usually every 3 months, and we alternate with the general dentist every 3 months.
Okay.
And occasionally, if things have plateaued and stabilized, we go every 4 months. So I usually advise, depending on the severity of the disease, not 6 month cleanings anymore. We usually tighten them.
Okay, but I'm hearing you say that there are things that are reversible.
Gingivitis is reversible because there's not breakdown of the bone and the attachment. And so the clinical signs are reversible, and even with periodontitis, when it involves the gums and the bone, we have patients that are maintained for 20, 30, 40 years. So, and then compliance is a huge part of that, and home care. We talk about home care is the most important part at arresting the disease. So brush for 2 minutes at least. And some patients, depending on how severe the disease is, if it's pretty involved, I ask them to brush not 2 minutes, but actually 3 or 4 minutes.
Oh my gosh, that becomes a long time.
I know.
Right?
Yes. The first time I started, an electric toothbrush is a little different than a manual toothbrush too, the technique. By the way, most electric toothbrushes nowadays have a 2-minute timer if they have a charger. Some of the spin brushes that you get off the rack don't have the timers, but the ones with the chargers typically have a 2-minute timer. And the first time I brushed, I really timed myself brushing. I was like, oh my gosh, I'm here for a super long time. This 2 minutes is a long time. So it seems like, 2 minutes, I can do that until you do it.
Yeah. So we have to put in, and I've noticed, like, I was just with my grandkids, right?
Yeah.
And they're yes, exactly. And their mom's dad is a dentist, right? And so they're really mindful about doing that. I mean, it's a fight.
Yeah.
It can be a fight, and I'm kind of like, this is a long time.
It is. Yes, even little kid toothbrushes, the electric toothbrushes, have timers on them because there's a reason for that. The reason is that plaque is really sticky. It's stickier than if you're just doing the 45 seconds like the average American spends. It's in what's called a biofilm. That bacteria that I talked about is actually in what's called a biofilm. And the best way I can describe what a biofilm is if if you have a boat that sits in water and you touch the boat, you know how it's slimy? Even though it's sitting in water, that's a biofilm. Okay. So within that slimy mess is a whole ecosystem. Gradients where it brings nutrition in and takes it out. So to disrupt that biofilm, you can't just point at a boat. You can't just point with a power washer because you can probably write your name right on the boat. You really do need to take a scrub brush to wash that biofilm off. And the same thing on your teeth. Plaque is laid down in a biofilm. So it kind of protects the bacteria that's there. So you really do need mechanical removal to be effective.
And can you tell the difference? I mean, if I brush for 2 minutes, 45 seconds or 2 minutes, can I tell the difference? Can I tell that I've removed the biofilm?
No, not right away. But how you will notice is that a week or two later, you'll say, oh gosh, my gums, they're not puffy anymore. And this is not as uncomfortable as it used to be to floss. So it's kind of, you're in for the long haul.
That's how I feel about Pilates.
Okay. That's a great analogy. Excellent.
I noticed this time it was easier to get up and down off the floor with the grandkids.
Right.
It's like, oh, this is that's the Pilates.
That's right. Yes, and when we do treatment, a non-surgical treatment, we bring the patient back to check. We need to measure. So we bring them back 4 to 6 weeks after that, and we take the same measurements that we did the first day to compare, to check compliance, to check plaque control. And the patients, one of the first things I ask patients when they come back is, do you notice a difference? Oftentimes it's very subtle, but a lot of times the patients will say, you know what? I noticed that they don't bleed anymore and they're not as tender.
Okay.
So it does. I mean, that's after 4 to 6 weeks after the treatment that you can notice that.
Okay. But that's not that long.
No.
It's
not
in the scheme of life, right?
Yes, exactly.
When we're talking about our last 10 years, right?
That's right.
That's years and years away.
Yes.
So the other thing I wanted to ask you is it says that you work with implants as well.
Yes.
So tell me about implants, because that's kind of like a big mystery too.
It is. And it's it's kind of been a revolution with implants, and how it has really a dental implant to replace a missing tooth or missing teeth has changed the way people look, smile, eat in their last, you can actually get it anytime.
I mean, my daughter got them she got one in her 20s, I think.
Yes, because if you break a tooth, exactly. Right. The standard of care nowadays for a missing tooth is a dental implant. And a dental implant is a super good replacement for a tooth. However, nothing's as perfect as a tooth. So if we can save a tooth, we prefer to do that. But if it's no saving it, a dental implant's awesome, because you don't have, and the reason why I said it was a more conservative restoration is because you don't have to touch adjacent teeth. You can put the implant where it's supposed to go without doing anything to the other teeth. And what I mean by that is, in the past, if you had a missing tooth, one option, a very popular option, would have been a bridge. A bridge is where you cut, you have a missing space, so the tooth on either side of the space gets cut down for a bridge or crowns, and then impressions are made, and a bridge or the crowns are slid over the teeth adjacent to the missing tooth, and it's cemented in place. So essentially, you're cutting down 2 good teeth to replace the missing tooth.
And you put a fake tooth in the middle.
That's right. That's a bridge.
Okay.
And that was the standard of care for a missing tooth in the 90s, 80s, 70s. But nowadays, it's a dental implant, which is a titanium screw that takes the place of the root of the tooth. You need to be free of disease, gum disease, before you do that. So the mouth has to be healthy. So the first thing we do when we have a patient that needs dental implants is make sure that their mouth is healthy and they don't have any gum disease to address, because we do that first. Address that. And then a dental implant is a cylinder, and the tooth shape is wider than that. So we have to make sure that there's an appropriate bone support to support that implant.
Because the screw goes into the bone.
Into the bone. And another thing that a lot of people don't recognize is that it takes a long time for a dental implant to get a tooth on it. So there's phases I tell patients. The first phase is maybe extracting that cracked or broken tooth. Extract that, and we usually bone graft the socket to maintain the integrity of the bone, because we want a nice amount of bone volume. So we take the tooth out and we bone graft it. Sometimes we can even put an implant in the same day as the tooth is extracted. There's certain cases we can do that. Then here comes the critical part. You have to wait anywhere between 4 and 6 months before you can load. I'm going to define load as chewing force.
Okay.
So it takes between 4 and 6 months to load a dental implant. We know studies show that if you load a dental implant, like chew with it too soon, you can actually get bone loss around the implant.
But how do you not chew if you've got it?
It's a space, so you don't chew with it.
Okay.
So it's actually implanted in the bone, so you don't load it. Yeah, so essentially
you haven't put the
no tooth is on
replacement tooth in yet.
Right.
Okay.
And sometimes you can do that too, as long as there's no chewing forces. You put a representation of a tooth on it, and the patient checks, biting forces and moving their tooth or their jaw forward and backwards. So there's no load on that, even though there might appear to be a tooth there. Okay. But it shouldn't be loaded for 4 to 6 months.
Okay.
And so it's a really nice replacement option. Sometimes we have to go through multiple steps to achieve the dental implant, but it's a really nice replacement. Another thing about implants is that they're susceptible to the same bacteria that causes periodontal disease. Around a tooth, we call it periodontitis, and around an implant, we call it peri-implantitis. So if you've had a history of periodontitis and you lose your teeth, you're kind of at a higher risk to develop peri-implantitis. If so, compliance, and we make sure that the patient is on board with that and knows that, there's risks with dental implants too. Yeah, not everyone works. Like a hip or knee replacement. Not every hip or knee replacement works, and not every dental implant works either.
Wow.
So,
but it sounds like a nicer option than
So much
what
better.
used to be there. Or dentures. My grandma had dentures.
yeah,
Oh my gosh.
I
It
know.
was horrible.
it is. And again, your grandma's generation, they got old, they got gray hair, and they lost their teeth. But even now, patients can have worn dentures for a long time. But the longer you wear dentures, the ridge that holds your denture on actually resorbs and flattens out. And that's where you get those little old people whose dentures are flying all over the places, because that ridge that used to hold a denture is flattening out.
But are
So-
they still viable options?
Yeah,
for-
and a lot of times it is. We can put a couple implants in, and they can actually snap the denture on top of it. The oldest person I ever put implants in was 95, cutest little lady. She came in and she said to me, "I'm sick of eating soup." So, I'm like, okay. So we talked about it, and I put 2 implants on her. She snapped in her bottom denture, and she was 95 at the time. I went to her 100th birthday party.
Oh my gosh.
And then she hung around till 102, and she was able to eat. And
Wow.
yeah, so age shouldn't matter. Some people say, "Well, I'm already 73," and I'm like, to your question, I always ask a patient, "Well, I'd like you to. Do you want to be able to chew as you age gracefully, or do you want to struggle?" And so when you put it in terms of eating, it's, I think, a little bit more palatable. That's my joke.
Yeah.
So
That's good. But it's true. And we were talking a little bit before we started about, I was at the event yesterday, and my functional nutritionist was saying that, she was able to support one client just by encouraging her to chew her food better. Because she was having stomach indigestions and issues, and it turned out she's not chewing her food.
Yeah.
So when you don't chew your food, you can't
digest properly, and then indigestion, and like we said, Ensure or other protein or other supplemental, things. Yeah, and then that dinner party you want to go to when you're 85, or you want to throw. Yeah, you're looking for the dips, because you can't chew the food, and it. Yeah,
Oh no, I don't want to do
It's
that.
way more enjoyable to eat with your teeth.
Well, and it's not, but it's not just the teeth. It's because the teeth provide so many other things. Like I sing in the choir, right?
Right.
And so they're always saying, "Put your tongue behind your teeth," or "Do this with your teeth," or what, and it's like a reference point, and it makes a big difference in how your sound comes out.
Exactly. I've had a couple of musicians who have had to adjust how they play their instruments. One guy in particular, I think he played, it was the saxophone, and he was worried about his front teeth because they were loose. So we waited till his season was done, and then we fixed him up so that he could properly use his mouthpiece.
Got
So,
it.
yeah, it was.
He
became conscious of.
Right, and it's not that we don't think teeth are important, but I guess we don't stop and think about how really important they are.
We take
right?
them for granted, and that's
right until they hurt.
until they yes, exactly.
So it helps with digestion, and I've also heard that it can have an issue with heart health.
Yeah, that's true, and that's like scary to think about that. And how the bottom line is chronic inflammation. And if your gums are chronically inflamed and challenging your immune system with bacteria, and I'll stick to bacteria, but if it's chronically challenging your immune system, it can have a negative effect on things like diabetes, stroke, Alzheimer's, because of the chronic inflammation. And a nice thing to think about, or kind of an easy way to think about it, is if you had an abscess or puffy, some sort of inflammation on your hand that you can actually see and feel, you would be at the doctor lickety-split. But when it's around your gums and it's a little more subtle, it's a little easier to put that in the back of your mind because you're living your life,
And it's not screaming at you.
Right.
Right? Yeah. Like if you get a mosquito bite or something.
Right.
It's just like right there.
Yes. And an analogy I use to talk about that too, the plaque around the gum line, is that if you have a sliver in your hand and you let it sit there, it'll get red and festery. It'll tell you it's there. But plaque around the teeth that has bacteria, it's a way more subtle. You might notice, as I mentioned earlier, some bleeding, or it's just a little puffiness. But it doesn't really scream at you, to use your term, like a sliver in your hand would.
Yeah.
And then when you take the sliver out of your hand, the area bleeds, and then it heals up.
Right.
Kind of the same thing happens around your gums when you adequately and frequently remove the bacteria from around there. The gum tissues will tighten and shrink because we like shallow pockets.
Okay.
So,
But it
for me,
doesn't do it. But what I'm hearing you say with dentistry versus some other things, it doesn't do it by itself. There's an intervention that we as humans have to take.
Exactly. Yeah. Even if you look back in history, throughout history, the way that humans have evolved is very interesting. If you go to a museum and they have human skulls there, you can kind of determine how old the skull is, maybe, and then how old the person was, maybe, too, based on the eruption pattern of the teeth and the wear pattern of the teeth, and even wisdom teeth. Like way back centuries ago, thousands of years ago, we all had 3 molars that were in a perfect alignment that chewed, because that's the way what our diet supported. Well, now as humans have evolved, we no longer have space in our jaws for wisdom teeth. So that's a sign of evolution and interesting to me.
That's fascinating,
I
actually.
think so too.
It's like, oh my gosh, how'd that happen?
Yeah, the next time you see ancient skulls and stuff, look at the teeth, because it can tell a lot about
things.
Yeah.
Oh my gosh. Okay. So this is great information. So one of the things I like to ask is if you are, somebody's listening and they want to know where to start. They want to take better care of their teeth. Where do they start?
Yeah, I love this question because it's really easy to pick up your toothbrush twice a day. And honestly, it makes a huge difference. I had a patient the other day who, between the time he was referred to see me and the time when I did his exam the other day, he said he noticed the numbers had gotten better when I read them off to when his dentist read them off, because he started paying attention to brushing twice a day and flossing. And just in that time period of between the time he was referred to I saw him, he noticed a huge difference. So it can happen. Just an ounce of prevention is worth a pound of cure.
Yeah.
And then brushing and flossing. Brush twice a day, every single day. And another thing is to proper brushing. We call it a toothbrush, but gum disease starts at the gum line. So to brush at the gum line is also very important. And the toothbrushes, like my electric toothbrush right now, will tell me with a light on it that if I'm pressing too hard. So maybe you can eliminate some damage or minimize some damage that you do if you're prone to brushing too hard.
Okay.
So there's a little red light on it. If you push too hard on it, it'll turn red.
And do you feel like it's worth the investment for an electric toothbrush versus a regular toothbrush?
I typically do. Studies show an increase in plaque reduction by about 30% with the proper use of an electric toothbrush.
Okay.
And then the proper use of an electric toothbrush is usually spending time at the gum line, like 2 to 3 seconds per tooth at the gum line, because that's where the plaque is forming.
At the gum. And I remember you saying once is that you take the toothbrush and you just leave it on the tooth.
Yeah.
You don't
with an electric toothbrush, that thing oscillates a lot more times per second than you can, which is another reason why we see an increase in plaque reduction, is because that thing is more effective at getting the plaque off and disrupting that biofilm.
Right. And if you look at the investment of that toothbrush versus having good healthy teeth, it's nothing.
I notice a huge difference. Like if I forget my electric toothbrush and when I'm traveling and I have a manual toothbrush, I notice.
I know it's like,
it doesn't feel
can't
as
get
clean.
it clean.
Yeah, exactly. And another really important thing is to change your toothbrush and the toothbrush head every 3 months.
Okay.
They wear out. The bristle quality goes down, and they really do wear out. Okay. So every 3 months we recommend changing your toothbrush or your bristle head or your brush head. Yeah.
Got it. It's just one more thing to do, but
I know.
But it's all good. It's worth it. It is totally worth it.
It is so worth it to age with your own teeth, your natural teeth.
Yeah.
And if you're already having issues with crowns, bridges, and dentures, there's things we can do to improve the quality of your chewing function. Through dental implants and maintenance and encouraging people to come in every 3 months or 4 months for cleanings. It no longer becomes a chore when you do it long enough.
Okay. And so so the first line is to go to your at your local dentist.
That's right.
Right? Okay. Because it's going to be your local dentist that refers them to you.
Correct.
I wouldn't call you and say, hey, I want to see you.
Yeah, no,
okay.
most 95% of our practice is referral based.
Okay.
5% of the people know that they have issues or have some other problem like a missing tooth or receded gum line, so they can self-refer.
Okay.
But most of them are referred from their general dentist. Yeah.
Wow. Okay.
Yeah.
Oh my gosh, so many things to think about, and I'm just kind of like now I'm like, okay, I am going to do this 2-minute thing.
Good.
You've inspired me.
Thank you. And
Right?
the flossing is
I
really
always
important.
floss.
Okay, good.
But I will say I didn't start flossing until I was in my 30s, and I got the lecture about flossing, and it took me a couple months to really do it, where now I can't live without it, right? I just, but it wasn't something, I mean, I had to intentionally make myself do it.
Yeah.
But once, it's like anything else, once you do, it's like,
Yeah.
it just doesn't feel right without it.
That's right. And, there's also, should you floss before you brush or should you floss after you brush?
Does it matter?
Technically, some studies support flossing before you brush. I'm a brush then floss person, but the studies support flossing first. I do it afterwards. And to me, it's if you're doing it, and I'm not gonna. It's okay. I'm not gonna split hairs. Just floss.
Just floss. Yeah. Well, thank you so much for being here and sharing your wisdom and brilliance with our guests and me. And I want to encourage our listeners to check out goodfatlife.com, where we have the digital version, and then we have where you can get a subscription and have it delivered to your house, and you can just have that joy of taking a few moments out for yourself, right?
Yeah.
So thank you again for being here.
Thank you for having me.
And I'm going to just take a little moment and do a shout out for Hands On Health, the chiropractic, and they are an amazing place to go. And if it doesn't matter how you feel when you walk in, you're going to feel amazing when you walk out. I will just tell you, the entire culture and of the practice and everybody there is, they're just so committed that you feel good.
That's awesome.
Right?
Yeah.
And it's just, again, taking care of yourself. So that's Hands On Health Chiropractic in Brighton, Michigan. So with that said, I would just, again, thank our guest. Thank you. Yes, and I'm looking forward to knitting tomorrow.
Yes, I am too.
And let's go out and live our good fat life. Thank you.
Thanks, Sherri.